Hi, this is Dr. Dumestre. Thank you for this question. So this patient is thinking they've had a reduction. Unfortunately, recovery was tough for them, and they might need a repeat breast reduction. So they're asking me specifically about the nipple and areola, and if they needed that grafted as a full thickness nipple graft, or a free nipple graft, FNG. What does that mean as far as nipple appearance, function, etc.? So reason why you may need a full thickness skin graft during a breast reduction, it's pretty rare, but it's in circumstances where the blood supply feeding your nipple and areola is compromised. So that can be from a previous breast reduction. That can be if you have very low hanging, long breasts. There's a really long distance between your kind of clavicle and all the way down to the nipple. So it's fairly uncommon, but there are very specific scenarios where we do use them. So in that case, if you're not having enough blood flow get through the piece of breast tissue that's attached, that's going all the way down to the nipple, then what we do is cut it off and stick it on. So that's often what patients think that we're doing for a standard breast reduction, but it's not. Usually for a standard breast reduction, nipples hanging at the end of a big piece of breast tissue, I rotate it, fold it on itself to get the nipple up into a perky position. So full thickness skin graft. Take a thin shaving of nipple and areola, make a little raw surface on the breast, and then stitch it down. Your underlying raw wound then feeds it and permanently incorporates it. Couple considerations. From a functional perspective, you lose the function of that nipple. So you lose the ability to breastfeed, and sometimes you lose the erectile ability of the nipple. So it doesn't necessarily get firm in the same way that it did in the past. You can still actually have some sensation following nipple grafts, and this tends to come on over a period of a year or so. Sensation's variable between patients. As far as the color of the nipple, it can look quite good. If there is discoloration, then I usually state to wait at least kind of 3 to 6 months for things to settle, and then a medical tattoo can actually cover and conceal that really nicely. Risk of discoloration is fairly high. Risk of it not taking, so that graft just kind of sloughs off, it doesn't stick, is actually really low. I would say in the kind of under 5% type range. Hope that helps. Have a great day.